Dr. Gerard's Weight Loss and Wellness Clinics. I'm Dr. Joni Gerard, and this is the new patient video for lipedema. You'll be watching this video if you are new to our clinic and have lipedema, or if you have been recently diagnosed with lipedema. I'm an obesity medicine specialist with a particular interest in lipedema, and am the founder of Lipedema Clinic. What I'm hoping that you will learn in this video is what lipedema is, how it is different, why it requires a different approach, and how to get started treating it. So what is lipedema? It is the most common inherited connective tissue disorder affecting the subcutaneous fatty tissue in women that is triggered by hormonal change, fueled by inflammation, and does not respond to typical calorie restriction or exercise. That's a big, long definition, but I think you will understand what I'm saying as we go through it in the next few slides. So bear with me. Lipedema is really common. It affects about 11% of adult women, and it's inherited. What I mean by that is that it's passed down through families in an autosomal dominant pattern with sparing of men. So the males in a family do not express it. It just affects the women. Why am I telling you this? I'm telling you this because I want you to understand that lipedema is not your fault. It's not a matter of pushing away from the table, willpower, or won't power. It is a genetic condition. We've known this for some time. In fact, in 2009, there was a paper published showing the inheritance pattern of lipedema. Again, you can see this pass through families affecting the women, not the men. As you can see in the diagrams here, women with lipedema are the dark black, colored in circles. Not all the women had it, but quite a few do. What does lipedema look like? Well, it affects that subcutaneous tissue just under the skin. So it's not the deep visceral fat, it's real superficial. And you can see that in the biopsies of lipedema tissue. Lipedema tissue will feel very nodular and firm to the touch. And you can see those lumps on the biopsies. The little white areas as well, that's fibrotic tissue. And that causes some of the symptoms that we see in lipedema as well. When you biopsy lipedema, it is very different, not just with the way it feels, and as you can see on the specimens, but also under the microscope, it is very different. Biopsies that were published in 2019 showed that there's a lot more inflammation in lipedema fat. There's scarring, the cells are bigger, there's more of them, there's fluid around, and there's other tissues affected, the blood vessels, the lymphatics. This demonstrates that lipedema isn't just a fat disorder, it actually affects all of the connective tissue in the subcutaneous area. Lipedema comes on with hormonal changes like puberty, pregnancy, medications, and menopause. Many things can make it worse, not just hormonal changes, but also excess body weight from obesity, inflammation, stress, lack of sleep. Many things can worsen lipedema. To get a diagnosis of lipedema, really, it's changed over the years. In the 1940s, when it was first described, there were criteria that then were changed in 51, 2016, 21, and again now in 2024, there was an updated diagnostic criteria published. What does that mean? It means that this has been a moving target over time, and likely the diagnosis will change again in the future. But right now, it's really 5 things that you need to be diagnosed with lipedema. 1, you have to be a female. 2, a disproportionate distribution of the fatty tissue. And you can see that in this picture where the hips and legs and even arms are affected, but the trunk is not. Number 3, pain and tenderness. This can mean something different depending on the woman. 4, tissue changes. Remember we talked about those white little fibrotic areas? Those cause dimpling and nodules to form where there's a lot of fibrosis within the tissue. Number 5 criteria, unaffected by typical calorie restriction or even bariatric surgery or extreme exercise. There are things that it does respond to, but not typically those. Supporting criteria includes easy bruising, cuffing, we'll show you some pictures of that, hormonal triggered, family history, and then swelling in the legs that doesn't go down when you push on it. There are no diagnostic tests to diagnose lipedema. It is purely clinical. That means it's based on your history and your exam. There's not a test, there's not an ultrasound or a lab test at this time that you can use to diagnose lipedema. What does it look like? Well, This may or may not be you. And I say that because lipedema looks different depending on the family and the individual. So what does lipedema look like? Well, in some of the types, you can see what we call an ankle cuff. And the blue arrow demonstrates that, where the tissue down the leg then comes in at the ankle and the foot is spared. Not all types of lipedema have the ankle cuff. Some have a cuff at the wrist. There is a disproportionate distribution of fatty tissue, and you can see this very well in this picture where the torso and the abdomen are quite thin, but the hips and the thighs are not. Dimpling or mattressing is from the fibrosis underneath that is retracting the skin down, and it looks like dimpling or cellulite. It's not, but oftentimes women believe that they have cellulite when in fact they have lipedema. Because of the fragile blood vessels, oftentimes women with lipedema have a lot of bruises over the affected areas, even with tiny bits of trauma. Most women say, I have no idea why I have these bruises, or they'll end up with really massive sizes of bruises for no particular reason. The picture on the right shows a woman that is very, very fit. She has great abdominal musculature. You can tell she's very fit and athletic, but her legs have not responded. She still has the disproportionate fatty distribution of lipedema tissue over her entire legs. Now, does lipedema only affect the hips and the thighs and the legs? And the answer is no. Lipedema also affects the arms. And in fact, 30 to 50% of women report lipedema tissue in their arms. It also affects the abdomen, particularly the lower abdomen, in that what I call the mommy muffin. You probably know what I'm talking about. Oftentimes that tissue is affected as well, and you can feel lumpy, bumpy areas of lipedema tissue along that region. Rarely does it affect the hands, although sometimes it can. Now, there are different types and stages of lipedema. I don't want you to focus on this. Just understand that it looks different on different women depending on where they're at in their progression and in their family. The type just means the location of the lipedema tissue. The stage means the progression. So as you can see in this picture, stage 1 is very different from stage 2, where you're starting to get some mattressing, some dimpling happening in the skin, more fibrotic and firm tissue underneath. Stage 3 is where you're starting to get larger mounds and some folding. And stage 4, really there's some question of, do we have stage 4 or is it just stage 3? But now we have lymphedema on top of that. So there's some shift happening within the stage definition as well right now. Does that mean everyone progresses? No, but a lot of people do if they don't take care of their lipedema, which is why it's important to be diagnosed soon and do something about it. Lipedema is often confused with obesity, lymphedema, fibromyalgia, venous insufficiency, and other fat disorders. And the tricky part is that all of these can be present together. It's important for you to understand that lipedema is not obesity, but they can be present together. So let's talk about the differences of them. Just because a person has an elevated BMI doesn't mean that it's all the same. Lipedema tends to present in teenage years, almost always before age 30, typically during puberty, where obesity can present at any age. Lipedema is precipitated by a hormonal change almost always. Typically, it's puberty, pregnancy, hysterectomy, menopause, medications, but sometimes it can be stress, where obesity can be precipitated by lots of things. Sometimes it's lifestyle changes, but it's a lot more complicated than that. Sometimes trauma, illness, medications can precipitate obesity. Lipedema tends to be painful, where obesity tends not to be. You can still get painful joints and have pain for other reasons, but the tissue itself is not painful. Lipedema tissue is in that subcutaneous area along the hips, legs, arms, where obesity fat is along the viscera, deep within the abdomen. It can be other places as well, but it's affecting that abdominal region. Lipedema is not typically associated with being a metabolic risk factor, meaning that it doesn't tend to be associated with diabetes or high blood pressure or those types of other conditions, at least early on. Now, this does change in more advanced stages. Obesity, on the other hand, does have metabolic risk factors associated with it, meaning diabetes, hypertension, heart disease, sleep apnea, and the like. The tissue in lipedema tends to be very firm, fibrotic, and very inflamed and tender, where tissue in obesity is very soft and supple. Oftentimes we say that lifestyle does not cause lipedema, and that is true, but lifestyle can make lipedema worse. So it's important to understand that. Oftentimes, if you have lipedema, you've also been diagnosed with some of these other health conditions. Does that mean one causes the other? No, I'm talking about association, not causation. So there is a difference. But many women with lipedema also suffer from inflammatory or autoimmune conditions, fibromyalgia, chronic pain syndromes, hypothyroidism, mental health issues, including anxiety, depression, and other eating disorders. Oftentimes, women with lipedema report having chronic fatigue, migraine headaches, POTS, and mast cell stabilization issues. Lipedema is also associated with obesity and diabetes, especially with advanced stages. Early on, it does not, but advanced stages, there is an association. Venous insufficiency, very common in women who have lipedema. Lymphedema also is often present in advanced stages of lipedema. We do understand from biopsies that the lymphatics are affected early on in lipedema. We just don't realize it clinically because we don't see it. Arthritis is also very common in lipedema. Hypermobility and connective tissue disorders, very common. MTHFR, which is just a methylation issue regarding your B vitamins, very common in lipedema. So if you have lipedema, you may have some of these other conditions. You don't have to, but you might. We often talk about all the downsides of lipedema, but there are also some perks that I want you to know about. Lipedema tissue serves as an inflammatory gauge for your body, meaning if you're doing something that's causing more inflammation in your body, whether it's stress, what you're eating, heavy metals, whatever it is that's causing inflammation, that lipedema tissue is going to let you know. It becomes larger, more painful, and fibrotic. So it's a great gauge to tell you how you're doing in your everyday life. Most women with lipedema also have low blood pressure. They tend to have better cholesterols, and they have a low risk of diabetes, high blood pressure, and cardiovascular disease, at least in the first few stages. Women with lipedema tend to be more flexible, and they tend to appear younger with less wrinkles. So these are some of the perks that you can notice if you have lipedema. You may have been told, wow, you have a great blood pressure for your BMI. Well, that's very common for women with lipedema. There are some reports, however, that these perks may disappear after liposuction if inflammation is not well controlled. I am often asked, what about the risk factors for progression? I'm in stage 1 and I do not want to progress on to the further stages. What can I do? Well, let's talk about those risk factors for progression. Specifically, what are the modifiable risk factors? What do I mean by that is that if you do something about these risk factors, you can prevent progression. The first one is treating obesity. So I'm so glad you're here with us in the clinic because we need to make sure that if you have excess body weight that's not lipedema tissue, that it is treated and kept in check because obesity will make lipedema progress. Inflammation is the second thing that you need to address. What's causing inflammation in your body? We'll talk more about that in a minute. If you have stress or poor sleep, that may be causing your lipedema to progress. And if you have an overwhelmed lymphatic system for a variety of reasons, that can cause progression. Some of the risk factors for progression that we can't really help, your genetics, hypermobility, when you're going through hormonal changes, sometimes we can't do anything about that. Injury, and if there's lymphedema present. Oftentimes, these are non-modifiable risk factors for progression. So what do we do when we look at treating lipedema? Well, what are our goals? Most of the time, our goals when we treat lipedema, prevent progression, reduce pain and inflammation, improve mobility, improve lymphatic flow, and reduce inches. Oftentimes, when women first come in, they look at number 5, I want to reduce the inches. Well, that's understandable, but we often need to address the first 4 to really get good sustainable change in reducing inches. So please be patient as you progress through your treatment. When you look at treating lipedema, we really need to focus on these 7 pillars to holistically approach treating lipedema: support, nutrition, activity, sleep and stress, supplements, lymphatic care, medical and surgical intervention. That's a lot to go over today. So I want you to know that there are more resources on www.lipedemaclinic.org. A lot of information we've put there so you can have resources from home that you can go over and learn more about your lipedema. So let's talk about the steps to start treating lipedema of what we're going to start with first. Number one, we need you to learn about lipedema, and there are resources that we've created just for you. Number two, we're going to treat excess body weight, and that's what you're going to get started on today in the clinic. First, looking at modifying your nutrition plan, activity. Most important is that you learn not to hurt yourself. It's time to help yourself and not hurt yourself. Secondly, we're going to look at medications to reduce food noise, improve hormones that are driving your weight gain, and reduce inflammation. Now, some of that's going to start today. Some of that may be at your next visit as well. Number three, reduce and remove inflammatory triggers. And that's really through holistically detoxing. Number four, improving lymphatic flow. And five, again, reducing inches. So let's really work on those first three steps today. I need you to learn about lipedema. The mission of Lipedema Clinic, it's an online hub, and the mission is to provide support, raise awareness, and offer resources to women and their loved ones about lipedema. Number two, treat excess body weight. Again, that's the focus of today's visit, getting started. The details are in your phase 1 booklet that you received at check-in. Modifying your nutrition plan and activity so that it's helping you and not hurting you. We're going to talk a little bit more about that in detail in just a minute. And then we're going to focus on medications today as well to help reduce food noise, look at what we need to do to improve your weight and immobilize fat, improve hormones driving your weight gain, and reduce inflammation. That's a lot today, but trust me, our providers will help you do that. So from a nutrition standpoint, yes, it is true that traditional calorie deficit does not improve lipedema. It is also true that dietary choices can worsen lipedema. It's true that proper nutrition can improve it, reduce inflammation, and improve your overall health and well-being. So we need you to get this right. Women with lipedema often have nutritional deficiencies. Your phase 1 booklet that you just received will teach you how to read the labels and calculate net carbs. Net carbs is a term coined by Dr. Atkins, and it looks at the impact that carbohydrates have on your body. And you take the total carbs minus the sugar, alcohols, and the fiber, and that gives you your net carbs. Phase 1 also goes through a nutrition plan that is low carbohydrate, moderate protein, and moderate fat. In your booklet, there are lots of details outlining foods to avoid, foods to put on your plan, what to drink, what not to drink, some recipes and meal planning ideas. So lots of information. Make sure you use that booklet that you received today. Now it's time to focus on lipedema-specific information. We know that a high-fat, low-carbohydrate diet, also called the ketogenic diet, is the preferred way of eating for women with lipedema. That's been demonstrated in multiple studies now. They're small studies and not very long, but at least they are starting to show that they do help women with lipedema. So these diets are designed for the body to use breakdown products of fats called ketones as the main fuel source for energy. So Dr. Gerard and I want you to change how you're eating to a modified ketogenic way of eating. What does that mean? It means that your net carbs for the day are going to be less than 20 grams. Your protein needs to be more than 100, so you're getting enough to maintain your muscle mass. And your fat grams need to be up over 100 grams a day as well. We would like you to follow a gluten-free diet to reduce inflammation, limit your dairy, and change the way you're eating to a timed restrictive eating time frame. So it's a little bit different schedule than most patients, but this is really specific for women with lipedema. I have some information there on the right-hand side. If you're following a 1,500 calorie diet, what does that mean in grams? So if you have a phone with you today, I'd like you to take a picture of this particular screen so you have it when you are looking at different labels and trying to figure out exactly what to eat for the day. So let's take just a second and talk about time restrictive eating. We don't often focus on this, but for lipedema, it's important because it reduces inflammation, improves insulin resistance, and begins the autophagia process in your body. That's the process where your body starts cleaning itself up. And I need a minimum of 12 hours of fasting. So what does that mean? Nothing to eat or drink for at least 12 hours. Now, as you know from your phase 1 booklet, you need to have breakfast within the first 3 hours of waking, and that's to help from a metabolic standpoint. That rule still holds. So whatever you need to do to calculate what works best for your life, I need at least 12 to 14 hours of fasting, but breakfast has to be within 3 hours of waking. Let's talk about activity for lipedema. It needs to be low impact, prevent injury, because remember, injury can cause inflammation and can cause lipedema tissue to worsen. We needed to support and stimulate lymphatic flow and support and stimulate venous clearance, reducing inflammation. Very, very important. So a little bit different than a lot of the activity or exercise that you hear about for weight loss. Walking is a great example. Being in water, getting onto a rebounder, all are great for lipedema. Now, you're here in the clinic, and I know you're interested in medications, and it's important to understand a lot of things in regards to medication and lipedema. Every woman with lipedema is unique, and they require a different treatment plan. So if someone in your family has lipedema and they used something that may or may not work for you, just understand we have to target what's best for you. We hear this all the time in the clinic when women tell us that have lipedema that their bodies change when they started taking a particular medication. That's something I need you to look out for. That if you started a new blood pressure pill, or you had a Mirena placed, or something was done and your lipedema got worse, you need to take note of it. In fact, every time you change a medication, you should be writing down what your weight is and checking it, in a week, 2 weeks, and in a couple of months. And if you gain significant weight with starting that medication, you need to talk to the prescribing doctor. This is a little bit terrifying. 36% of excess body weight is iatrogenic. What does that mean? Something that your healthcare team did has caused weight gain. So this isn't just about lipedema. This is about weight gain in general. If you notice an increase in leg diameter, heaviness, fluid retention, or pain, you need to let your prescribing doctor know, but never ever abruptly stop medication without consulting with the prescribing doctor. Oftentimes, there are substitutions that are more weight friendly and lipedema friendly. We just need to help you find it. So medications specifically for treating lipedema. Now, there are no medications approved to treat lipedema. None are FDA approved, but we use a lot of medications in an off-label fashion to help our patients with lipedema. So I want you to know there are a lot of options out there for you. But this is a unique journey for you. And again, what one patient may respond to may or may not apply to you, but our providers will help guide you in this process, whether it's treating excess body weight, controlling food noise, looking at is a sympathomimetic or what we call an appetite suppressant right for you. Now, these are particularly helpful for women with lipedema. About 90% of women with lipedema report an improvement in their quality of life. Why? Well, that's for a variety of reasons. They help with fat mobilization, improve fatigue. They also help with improved vascular tone. So a lot of women report that their legs feel less heavy. Also, we need to look at inflammatory control for you. And our providers will help target what we can do from a medication standpoint to help you with that journey. Sometimes it's using HCG. Sometimes there are other medications that we utilize as well. Each person responds uniquely different to nutrition, exercise, medication. So again, this has to be tailored to you. Let's take just a minute and talk about appetite suppressants. They are medications that help suppress appetite, but in lipedema, they do some unique things as well. They help support the vascular tone, and that helps with how heavy legs are in lipedema. They also help mobilize fat out of the fat cell. However, appetite suppressants aren't necessarily for everyone. If you have cardiovascular conditions that are unstable or uncontrolled blood pressure or hyperthyroidism, certain types of glaucoma, or even unstable mental health issues, appetite suppressants may not be for you. So your provider will review that with you today. The most common side effects of appetite suppressants are dry mouth and insomnia. There are some other side effects that you can find in your phase 1 booklet, as well as what to do about those side effects if you should experience them. HCG, or known as human chorionic gonadotropin, has been utilized by Dr. Gerard for over 40 years with great results, particularly for women who have hormonally triggered weight gain. Women with lipedema often report that they see benefits from HCG, not just the anti-inflammatory aspect where they have improvement in stiffness and pain, but also in a reduction of inches, and seems to help some of those perimenopausal challenges that we have: vaginal dryness, decreased libido, loss of muscle mass. All of those things can be helped with HCG. Not all women can utilize HCG, unfortunately. If you have a hormone-mediated or responsive tumor, then HCG should not be utilized. If you have a breast mass that needs to be diagnosed, or vaginal bleeding that you're not sure what the cause is, those need to be sorted before you take HCG. If you've ever had a blood clot from hormones, meaning during pregnancy or because of hormone replacement, you should not utilize HCG either. So the most common side effect of HCG is breast tenderness and maybe some change in your menstrual cycle. Both of these tend to be mild, but if you do experience that, make sure you tell your provider about that. Additional information about HCG is in your phase 1 booklet. Please review that. Your provider will talk about HCG and appetite suppressants with you and will help you make a decision if they are right for you or not. You may or may not want to try them at this first visit, but maybe at the next visit, depending on how you respond in your journey. Let's jump ahead to liposuction because we often are asked, what about liposuction? Well, it's really important that when you think about liposuction that we do some preparation for liposuction ahead of time so that we can look at a good result after liposuction. Most importantly is that we optimize your weight ahead of time and that we control inflammation and your lymphatics are well taken care of. And that you see a liposuction surgeon that is a plastic surgeon well-versed in liposuction specifically for lipedema and that they utilize very specific types of liposuction for you. What are the most common reasons that we see a less than optimal result from liposuction? Uncontrolled weight before surgery or after surgery. Inflammation isn't well controlled. Inadequate compression, inadequate lymphatic fluid, untreated underlying venous disease, insulin resistance, and then surgeon experience. I point this out, these are actually pictures from a liposuction surgeon overseas. And you can see that with conservative treatment, great response. And then we had surgical intervention and then conservative treatment was not continued. So it really drives home the point that we need to make sure we take care of you before surgery and after surgery to make sure that you have optimal results. Do all women with lipedema need surgery? No, they don't. But some women will decide to have lipedema surgery. So let's talk about inflammation. Step 3, we need to reduce and remove as many inflammatory triggers in your body to prevent progression. This is so important, and this is your homework. This is a little bit different than what we do in typical phase 1, but this is your homework. I need you to start looking at your life and assessing what your triggers are. Is it non-restorative sleep? Is it stress? Is it food triggers, preservatives, medications, hormones, vaccines, environmental toxins and exposures, obesity, infections, viruses, autoimmune conditions, illness, injury, over-exercising? Are there heavy metals present that are causing inflammation in your body? What are your triggers? And again, every woman is different. Why does inflammation matter? Why do I keep talking about that? Well, it is the single greatest contributor to lipedema symptoms and progression. So we have inflammation in the setting of lymphatic fluid come together and cause adipogenesis. What does that mean? Adipogenesis means fat growth. We want to halt that process. So we have to treat the inflammation, get rid of that, support the lymphatic fluid so that does not happen. Inflammation leads to fibrosis, larger fat cells, and fluid retention. And uncontrolled inflammation and toxins accelerate lipedema progression. Step 3, reducing and removing inflammatory triggers. This is your homework, reducing exposures. And we talked about all of those that may be causing it for you. And now we need to look at removing it through holistic detoxing. What are those steps? Again, back to those pillars that you saw before. Support, get connected. Nutrition, reduce exposures and that support detoxing. Activity, reduce inflammation, reduce injuries, and support detoxing. Supplements, we'll talk just a little bit more about that in a minute, but we want to look at binding heavy metals, support your immune system and liver support, correct deficiencies, and improve your gut flora. All of those are important when we look at detoxing. Addressing sleep and stress. Again, reducing those triggers and supporting the body's natural detox and healing processes. Lymphatic care. So whether it's manual lymphatic drainage, MLD, compression, vibration, rebounding, being in water, all of those to reduce the fluid that's hanging around. Next step would be your medication to reduce inflammation as well. You can learn more about this at lipedemadetox.com. There is a lot more information out there, and I'm giving you some homework. So what supplements do we typically include in that detox process? So zeolite, because it helps to bind to heavy metals and it helps you excrete them out of your body. NAC, I love NAC because it helps support the immune system, but it also tends to soften that fibrotic tissue that we feel in lipedema tissue, supports your liver, and it also helps with sweet cravings. Pre and probiotics, really important for helping to restore healthy gut flora and natural digestion. Often women have nutritional deficiencies because of inflammation in their gut. So important that we tackle some of that. A good multivitamin with minerals designed to help support methylation and to replace nutritional gaps for women that have lipedema. So what happens next during your visit today? Well, I'd like you to return your paperwork and video to reception. Workup staff will then greet you, review your history, and perform measurements, including a body composition measurement. Then your provider will see you. They'll review your information, complete a brief exam, and discuss a treatment plan specifically designed for you. Then it's time to do your homework, not just reviewing your phase 1 booklet, but getting connected and learning more about lipedema, starting with detoxing. Again, thank you for choosing Dr. Gerard's Weight Loss and Wellness Clinics. We are so glad that you're here, and we're excited to partner with you in your journey.